So just to get started, if you move us on, Imogen, just to kind of zone back into the purpose of today's session. I know everyone will have seen the agenda, but today is all about talking about how we're embedding movement into health and care systems in Greater Manchester. And we hope to bring that to life today through sharing a number of approaches and stories and the progress we've made so far in Greater Manchester. We also want it to be an opportunity for you to connect with others who are driving this work, recognising it's a collective effort across all our different organisations, and get your input into thinking about what are our key priorities and new opportunities going forward. So next slide, please, Imogen. So just to give a bit of context.
Beth,
hello.
Hi, Beth. It's Rachel.
Are you okay?
Yeah, I just wanted to just say hello to people and just say I'm sorry I can't stay for the whole event. I just wanted to introduce myself and just say a quick hello, if that's okay.
Yeah, great, go for it.
Yeah, hello everybody. I'm Rachel Egan. I'm the non-exec director for one of the non-exec directors for Greater Manchester NHS, and I chair the Population Health Committee as well as remuneration, and I'm the vice chair for finance. And I was hoping to join you for the full event today. I'm not able to, unfortunately, but I just wanted to say up front at the start of the session that GM Moving has the full support of the board and of the Population Health Committee. We had a fantastic presentation a few weeks ago from Beth and colleagues sharing the brilliant work that's happening around GM Moving. And I just wanted to say how brilliant we all thought it was and how brilliant I think it is. And I really look forward to feedback from today and hearing back via Beth about how the board and the Population Health Committee can support GM Moving going forward.
Brill. Thanks, Rachel. That's great.
All right. Thanks so much. Have a great event.
Brill, thank you. And we'll be hearing from Dave and others from the Population Health team as well about how GM Moving links into the ICP strategies. So that's great.
Perfect.
So yeah, just to thank you. Zone into what Greater Manchester Moving is for those who are kind of less familiar. I know people will be very familiar with it, but some less so. Just to say that Greater Manchester Moving is a movement of organisations, individuals, communities, many of all of you in this room and many more outside this room, all with the kind of collective goal and ambition of active lives for all. So how we support every individual to be more active. And in the middle of that screen, you'll see the purple GM Moving in Action strategy, which is, I suppose, our framework and our approach, our ways of working to how we do that collectively together. Above that, we also very much keep an eye on the Uniting the Movement strategy and use that as our kind of North Star, if you like, and helps us give us direction. So we're connected to the national landscape around physical activity and movement. And then beneath the purple box, we've also got the blue box, which represents GM Moving as an organisation. So that's who I work for. We've got a core team who I suppose has capacity and energy to drive the implementation of that GM Moving in Action strategy. So we recognise that it's a collective responsibility to implement the strategy, but we have some specific roles and responsibilities to make sure that happens. And one of one of those ways we play that role is facilitating days like this to bring us together. Next slide, please. Yeah, thank you. And yeah, just to say, we'll hear in detail a little bit more about how we contribute to the ICP strategy, but very much like we connect to the United Movement strategy, we also are very connected to GM ICP strategy and see our role being essential to realising that vision that is in the ICP strategy. But I'll leave Dave to talk about that in more detail. And then next slide, please, Neve. So why have we got a strategy? Why are we bothered about movement and physical activity? And many people in the room will be advocates for movement and physical activity, but we do know movement matters to absolutely every individual. It's essential for people to thrive, to be healthy, to be happy. But we also know that not for for everyone, the conditions in where we live or work don't necessarily support us to be active or to move more. So we've got a responsibility to work together to design movement back into our lives, and that includes into the health and care systems which we all connect to. But it's not going to be one organisation or one individual that kind of makes that change happen. We need to work together, and we all have a role together to enable that to happen. Next slide, please, Niamh. So we're just going to move into Menti mode now. So if you could connect to Menti via the QR code or by going to menti.com. If you've never used it before, hopefully it's quite easy. But if you go to menti.com and add the code in, or go direct via the link that you'll get when you go on to the QR code, we're just going to ask 3 questions just to get people engaged and thinking about who we've got in the room. So I'm going to ask Niamh to stop sharing, and if someone could put the Menti code in chat, so for those who are not already on there, get a chance to go in. And I'm going to share the Menti screen if this technology works for me. Here we go. So first question is, where do you work? So I just want to get a sense of who we've got in the room. The fact that there's quite a lot of people putting other means my criteria or the things I've put in there don't necessarily represent where you're from. So I'm sorry if I've not got the right place of work for you, but hopefully something resonates with you, and it gives a sense that we've got a lot of different sectors and partners in the room, all interested and contributing to GM moving and supporting increased physical activity. So I'll just give a couple more seconds on that. And great to see a good mix. Be interested to get a sense of others. So hopefully if you've introduced yourself in chat, we'll get a sense of that from there. Brill. And then moving us on to the next slide, hopefully the next question, if it's going to allow us to do that. This is where technology is going to do me in. Oh, okay, brilliant. So why does movement matter to you? So I've touched on why it matters to us to have a strategy in Greater Manchester, but interested in knowing from a personal perspective or from a work perspective, why movement matters to you and your work, and in one word or a couple of words, why it's important to you, your family or your work. Brill. I'll just give a couple of seconds for that to come through. Yeah, and as expected, a range of things focusing on health, physical and mental, transformative, improves mood. Brill. Great. We're all in the right space and mindset for it then. Brilliant. Okay, and then finally, just thinking about Greater Manchester, if you work in Greater Manchester or the place that you work, just interested to know on a kind of scale of 1 to 10, how aware you are or how confident you are of understanding the approaches that support movement or physical activity in health and care in the place that you live or work. So 1 being not at all, 10 being very much aware and very much so, to just to gauge in the room where we're at with that understanding or that awareness. Real. So good mix, but quite a few people feeling quite confident around that 8 mark. And what we're hoping today is that some of the presentations and examples that you hear will help those people who maybe feel they're below 5 or 5 and below and not quite aware as much as they could be around the approaches that will shift you into those higher figures. So that's one of the aims of today. So Niamh, if you want to share your slides again, and we'll be capturing these results and sharing them after the presentation as well, after today's session. Brilliant. Okay, so before I hand over to Dave, just a couple more points from me. You can skip on to the next one, please, Niamh. Hopefully that's coming up. So next one, with the timeline, I think it is. It coming up. I've just got a blank screen there. Is that showing for you, Niamh, or what can you see?
Yeah, it's just blank for me. I think it's just taking a minute to load.
Is it? Brill. Well, I'll just say what hopefully this slide will show us is, I was going to say that embedding movement and physical activity into health and care isn't a new thing for us in Greater Manchester. We've been on a bit of a journey with that. We've got a timeline that hopefully is going to come up shortly. But just to say, it's been a priority. It's been an agenda for us in Greater Manchester, working collectively across GM for a number of years to achieve our goal of embedding physical activity and movement into health and care. I'm not sure if those slides are going to come up again, Neve. You might need to stop sharing and try again. It was all going so well with technology. Bear with us a second.
I think you might just have to go on to the next one, Beth.
Yeah, that's fine. Will it show the next one?
Can you see that one?
It's blank for me, but I don't know if anyone else can see anything.
Yeah, we can see the inactivity levels, the chart.
Right, yeah. Brill.
Yeah.
I'll freestyle it off memory. I can just see. Oh, it's come up now. Brill. Yeah, and just to say, in terms of progress and what we're seeing from a inactivity level point of view, so this graph is demonstrating active lives data that Sport England provides. That before the pandemic, so the dotted line represents the time period where we had the pandemic. Before that, we were seeing some real progress in Greater Manchester around inactivity levels decreasing, and they were decreasing 2.5 times the national rates. That blue line demonstrating Greater Manchester. Unfortunately, during the pandemic, we saw an increase in activity, which we know happened across the country, but happened particularly in certain communities and demographics in Greater Manchester. But the positive signs are that we're seeing a big recovery in Greater Manchester now and continue to see that, and the data is demonstrating that. Next slide, please, Neve. The other point really is that we measure progress in many different ways, not just through stats, but also looking at system conditions. So we've got 5 ways of working or enablers that are evidence-based through the evaluation we've been doing over a number of years that show us that there are things that we need in place to enable change and to support physical activity increasing in Greater Manchester. And we're seeing an increase in maturity of those conditions in Greater Manchester over the years. So we know the work that we're doing is making a difference. Next slide, please, Neve. And out of the evaluation and the insight that we've gathered over the years as well, we know there are certain things and certain ways of working that help specifically in the health and care space. So many of you in the room will have contributed to this insight through interviews and workshops that we've done over the last couple of years. And we continue to use this framework, these 8 pragmatic responses and ways of working to drive our work going forward. Next slide, please, Neve. And that's also given us our priorities at a local level of where we want to pay our attention and our energy. So we have these priority areas, and you'll hear shortly from numbers of different people in the team about some of the approaches we're taking to focus on these priority areas. And then lastly, I just wanted to kind of say, if you go to the next slide, Neve, we're now able to kind of share lots of different stories and progress from different examples across the health and care system. So you'll hear in a second some of those examples, but would encourage you to go to GM Moving website, where you'll see lots of stories and case stories about the different ways of working, whether that's through campaigns, through influencing policy, through training, and through supporting GP practices around embedding physical activity into their work. So lots of different examples of how we're doing that as a collective across Greater Manchester. So I'm now going to pass on to Dave, who's going to talk a little bit more about the ICP strategy and GM Moving's role in that.
Thanks very much, Beth, and we'll see how we get on with the slides changing over. So, afternoon, everybody. My name's Dave Bulger. I'm Associate Director of Population Health at NHS Greater Manchester. And I think on the call alongside me is Warren Hepperlet, who's our Chief Officer for Strategy and Innovation. and Jane Pilkington, who's our Director of Population Health. And I think it's just worth, before moving on to the slides, the slide that Hayley put into the chat that Beth couldn't quite get to come onto the screen, which is about this being a journey. And I think it's worth starting by saying that this isn't a new relationship between NHS Greater Manchester and GM Moving or Greater Sport. This is a long-standing relationship over at least a decade. And actually, I think what we've built over that year is a really strong mutual understanding of how we get the best out of each other in order to improve outcomes for local people. So if we can move on, Niamh. I think I'm going to start just by a couple of reflections on what I'm not going to do. So I'm not going to start explaining to people why physical activity matters. My hunch is that 99.9% on this call know and are really strong advocates of that. And I'm also not going to touch upon what it means at a local delivery level or in a provider organisation to actually engage people and involve people and support people to become more physically active, because actually there are people in this call who are more experts in that than I am. And I'm really looking forward actually to hearing some of the examples of what this looks like in real life. So if we can just move on again, please, Niamh, to the slide after this one. There we go. So just a little bit of context. And again, people will be familiar with some of these key points. But the first thing is to say that the health of people in Greater Manchester is poor. And unfortunately, that health is getting poorer post-COVID. So on average, people who live in GM become ill earlier, live in poor health for longer, and die earlier than the national average. And actually, even though that itself seems really bleak, it also masks some really significant geographic and demographic health inequalities within the city region, but also within localities. So colleagues from Bury, Bolton, Oldham, Rochdale, whoever are on the call, will recognise that within their patch, you can walk 5 miles and see people lose 10 years of life expectancy. And so that's a big part of the context within why we feel physical activity, and particularly ensuring that everybody is able to be physically active, is really, really important. As well as that population health challenge, and very much aligned to it, we do also face some significant financial performance and quality challenges across the health and care system in GM at the moment. It's to some extent the elephant in the room. But actually, it's really important to recognise that even whilst we face those challenges, we see population health and prevention and physical activity within that as being one of the cornerstones of finding our way through those challenges and out the other side. And actually, we also have the opportunity in Greater Manchester to actually mobilise a wide range of whole system resources and to scale up our approaches to population health and prevention that many areas can't do and many areas are really envious of. And actually, that's why we have confidence that actually by doing the right things and investing in the right way and doing that sustainably and over time, we'll see real change in our population. And GM Moving is a great example of that, where we can evidence change and we can evidence an impact on inequalities and outcomes for people. So if we can just move on again, Niamh. So what I'm going to talk about really is just a number of the key strategies, frameworks, models and approaches that provide the scaffolding for our population health model in Greater Manchester. And that's really important when we start to think about a wide-ranging approach to improving physical activity and where that can fit in, because I think this is no longer just about how do you support more people to be active through primary prevention. I think the role of physical activity cross-cuts the totality of what we do within health and care. And so I'm just going to touch upon a couple of things. And the first one that Beth has already mentioned is, as an ICB, we have a strategy and we have a joint forward plan that was signed off by colleagues from across the system. And at the heart of that model is a commitment to give everybody in Greater Manchester the best possible life. And there are 6 missions, and I won't go through them in detail. I'm sure colleagues will look at the strategy if they haven't already done so, but I'm sure many already have done so. But actually within that strategy, there is a really strong and explicit focus on the importance of prevention and the importance of supporting people to be physically active. If we can move on, Niamh. And also within our strategy, we talk explicitly about the need to pivot our system towards a social model for health and away from an overtly medical model of care. And again, within that, there is reference made, and it's actually, it's not a great visual for on a slide, but in that conditions for good life section, it does talk about people being able to be active. It talks about active travel. It talks about active communities and physically active people. And even in a system such as ours at the moment, where we do face some considerable challenges, it's probably worth reflecting that, unfortunately, myself and Warren and Jane and others, we get to read a lot of ICP strategies and joint forward plans from lots of different places. I'm yet to see one that has a stronger focus on prevention, as ours does in Greater Manchester. And I'm yet to see one that overtly talks about a social model of care in the way that we do. And so actually that gives us a really strong starting point. And I think it's something as a system, we often forget actually how far on we are in our journey and how much opportunity we have compared to many other areas. So next slide. So just talk a little bit about the way that we view population health in Greater Manchester, because I think it's really important to then translating this thinking into what does this mean for physical activity within our population. So this is a model that we co-produced with a number of key partners about 5 years ago, and that was ourselves, it was a lot of providers, it was the Combined Authority, it was local government, it was ADPH, and it was a number of external partners such as the King's Fund and Health Foundation as well. But what this model fundamentally says is that to improve health and reduce inequalities at the scale that is required in Greater Manchester, it's not enough to just do a lot of projects that are largely focused on modifiable risk behaviours. So things like physical activity, things like diet and healthy, having a healthy diet, smoking and alcohol. Actually, to improve health outcomes at scale, you need balanced action across and between 4 main domains. The first one is the way in which you address the wider social and commercial determinants of health. And I guess to demystify that, this is the things about the places that people live, the conditions that they live in and the experiences that they have. And they are the single biggest determinant of people's health outcomes and health inequalities. And so when we consider that in the context of physical activity, what is it about the places that our populations live and the experiences they have that will influence the extent to which they are physically active or not? It still is about what is described here as behaviour and lifestyles, but those things that people do that can be conducive to good health or can be counter to good health. It's about what we describe here as public service reform, but again, I'll demystify as it's the way we deliver good quality joined up services in neighbourhoods that support people in the right way at the right time. And then the final circle is around recognising that the people who live in Greater Manchester are our biggest asset, and the communities they live in are an asset, and actually mobilising that is really, really critical. So our model of improving health in Greater Manchester recognises that need for balanced action across those 4 domains, but also requires the ability to shape the characteristics and the features of the system to enable the outcomes and the impact of doing things in those 4 spaces to be optimised. And then to the right-hand side is really a philosophy that we hold fast to, which is we have a system where we believe health promotion and population health and prevention is best locally led and GM supported and nationally enabled. And that's something we really try to hold fast to. If we can go on again, Niamh. I won't go into lots of detail on this one. People will read it at their leisure afterwards, but this is really takes that model and says, but what does that mean in terms of how we focus our attention and activity on the ground? And I just want to draw people's attention to a couple of things. One is the way that we describe this, which is it is comprehensive and whole system. Because again, you don't improve health at the scale we're looking to by dabbling around with a small number of projects. You do it by doing things at scale comprehensively and recognising the role that everyone has to play. And then what we fundamentally believe is that you need to take action across the 4 pale blue boxes. So you need to shape GM as a place that is conducive to good health by working together to address the root causes. We need to enable people to live healthier lives by mobilising those comprehensive approaches to tackling behavioural risk factors. And GM Moving is one such comprehensive approaches and is one of the best examples that we've actually got. We need to scale up secondary prevention. So what do we do to ensure people who are at risk of poor health have any poor health detected at the earliest opportunity, but are also provided with high quality evidence-based interventions to return them to good health as soon as possible. And then finally, we need to support people who are already living in poor health to live the best possible life they can by optimising the treatment that they can access and supporting people to have the best possible mechanisms for managing health conditions. So skip on, Neve. And again, I won't really talk about this one, but this is then to say that what this then looks like in reality for this year is our population health business plan that has been signed off at the Population Health Committee in the ICB, sets out a number of strategic priorities, but then there's lots of detail that sits behind that, including the focus on physical activity. So if we can move on again, Neve. What I wanted to do in that first bit there was set the scene as to this is the way that we think about prevention and population health, and really to provoke a conversation this afternoon that says, actually, where does GM moving and our work on physical activity interface with that? What are we doing that shapes GM as a place conducive to good health? How are we supporting people to change behaviours? How do we knit this into early intervention, prevention, and support in primary and secondary care? And how does physical activity become a part of people's treatment and care when they are living with a long-term condition? So through that, I want to kind of identify and flag 3 opportunities. And I won't read these slides out, but I think it hopefully frames some of the things we can pose as a challenge to ourselves. The first one, and this applies as much to GM colleagues, but also to colleagues external to GM, is how do we realise an ambition? And in our case, it's a really explicit ambition in the ICP strategy around enabling an active population. But words are words. And actually the opportunity is how do we translate these words and the mandate that they provide to truly mobilise a comprehensive approach to enabling physical activity across our population? How do we bring that strategic mission to life? If you move on, Neve. The second opportunity then is much more tied to what can we do in year in that population health plan. And so if I read what that plan says, it talks about continue our ongoing work to embed physical activity as a consideration across the totality of the health and care system, including prevention of poor health, and actually with a particular focus this year on CVD and diabetes, which is where we are currently mobilising a whole system comprehensive response in recognition they are 2 of the single biggest drivers of poor health in Greater Manchester. My challenge would be, what is the role of physical activity and how do we bring that to life? And then how do we take the GM moving strategy forward in its entirety and put in place the right support arrangements? And it talks upon here about the 3-year NHS GM contribution. And this is an example of where I hope as an organisation we do put our money where our mouth is. And actually what we've managed to finally confirm this week is that over the next 3 years, we will be investing just over £2 million in the delivery of the GM moving strategy, which is a real statement of intent, and I think is probably out with what any ICB in the country is doing in relation to physical activity. And then the final slide, please, Neve, is also recognising that GM moving is one of the best examples that we've got of comprehensive whole system transformation and of a population health intervention that mirrors our model of whole system comprehensive partnership approaches. So actually I come to this with a slightly different hat as well, which is what can I learn from GM moving and from our system-wide approach to physical activity that I can take and share and transfer and scale across all of the other programmes that are currently being delivered in Greater Manchester, or that we might deliver in the future that are aimed at improving the health of our population, because I think GM moving is a goldmine of insights and learning that we can take forward and build upon. And I think that was the end of my slides.
Real. Thank you, Dave. That was great. And we're going to move swiftly to Claire and Imogen, who are going to talk a little bit about the approaches we're seeing at a GM level. Thanks very much, Dave. So Claire, over to you.
Thank you. I'm getting Imogen's going to speak first.
Yeah, hi. Neve, can we go on to the next slide, please? Yeah, so hi everyone. So I just thought I'd kind of talk through very briefly this kind of model here that we all recognise as the whole system approach. Also really aware that that kind of phrase and that kind of wording is talked about quite a lot, and I'm aware that some people in the room today might appreciate kind of a refresher of what we mean by a whole system approach, particularly when we're talking about that in relation to embedding movement into health and care. So essentially, this kind of socio-economical model is kind of the multiple layers that really make up the system and essentially influence how we experience the world and move about in the world. So I just thought it'd be quite useful to show you here some examples on the left-hand side of what that looks like within health and care. So I won't talk through all of them because I'm already aware of time. But for example, you know, at the policy level, we have the GM mental health strategy, really just ensuring that physical activity and movement is on the agenda for mental health. And it's great that we're seeing so many different things at all these different layers. What we mean by the kind of enablers for change and the pragmatic responses that have been mentioned previously by Beth and Dave in previous updates is that we know how to do this real change. For that to happen, it needs to happen at all these different levels regarding kind of physical activity's role in our overall experience of the world. And really importantly, having individuals and communities at the heart of those conversations. So yeah, it's about kind of working with people at all these different levels to make real change happen. So for the next couple of slides, Claire and I are just going to speak to some of these examples in a bit more detail so you can understand what that actually looks like. Can you move on to the next slide, Neve? Thanks. I'm going to hand over to Claire for this one.
Hi everyone. So I'm just going to talk through some of the approaches that we've been taken to try and embed movement into health and care systems. So we recognise that there's some fantastic training opportunities that are already available, such as physical activity clinical champions, moving medicine, etc. So what we're doing is we're actively going out and promoting this within health and care, and we're making those connections so that they can actively get involved and then potentially change the way they work to try and embed health and care into those conversations that they're having with individuals. Next slide, please, Lee. An example of this is the physical activity clinical champions training, which is evidence-based physical activity programme for health and social care professionals. We work really closely with Jan Sinclair, who's a senior public health nurse, and she goes round and she offers the training to different people. And we're connecting her with the likes of primary care, talking therapies and social prescribing services. And an example of this is the Be Well social prescribing service in Manchester, who recently went on the training, and their positive feedback about this, which will is going to get rolled out to the rest of the team, hopefully soon. And they made reference to the really good resources that were available through this training. And it's also helped some of them to build their confidence to embed these conversations into what they do every day and when they're speaking to individuals. Next slide, please. Another approach we use is data and insight. And we use that data and insight to highlight the inequality of access or uptake to physical activity opportunities to ensure that we're not excluding communities. Next slide, please. And this is just kind of a slide to kind of say, well, why do we use data and insight? So it helps us understand where the levels of activity are lower. It informs us about the areas in Greater Manchester where there might be a need for more focus. It helps us to compare activity levels with other areas so we can understand what might be working well, share good practice and replicate things. It helps us to identify the area of needs and inequality, which might be a cause for lower activity levels. And it helps us to identify where we need to focus and connect and build more relationships with trusted partners within health and social care about the benefits of increasing activity levels. And although data and insight is really important, we also need to kind of really connect with people who work on the ground and at a neighbourhood level so we can understand different demographics, different communities, and how we might tailor our approach or approaches within those kind of local levels to understand the data a little bit more. Next slide, please. So we talk about community. Oh, sorry. Sorry, Imogen. Community champions and trusted transmitters. So basically, we need people to go out and share the stories of physical activity and why it's important. And we're building connections all the time, building those really firm relationships within healthcare, within neighbourhood levels. We're doing that all the time, and we're actively, you know, making those connections and building upon them relationships all the time to try and get the messages across, and create a ripple effect, really. And I'm going to hand over to Imogen, who's going to give you an example of key kind of champion, really, who we've been working really closely with, and that's Urban Village Medical Practice. Imogen, explain more.
Thanks, Claire and Neve. Yeah, I just wanted to say I think it was a really nice segue from the data insight slide that Claire just spoke about as well, because I think it's very easy when we're talking about data and insight that we focus on the numbers, which are obviously very important, as we know. But something that we're doing at GM Moving, and that we hope to encourage other people to do as well, is to focus on the storytelling element as well of data and how impactful that can be, and really kind of giving a fuller picture of the amazing work that's going on, but also of any challenges that are coming up along the way that we can then address together. So as Claire mentioned, one of the pieces of work that we've been doing is around active practices. So this is an initiative that's been created by the Royal College of GPs along with Sport England, and it's a charter that practices can sign up to, that recognises the dedicated steps that they're taking to increase movement and reduce sedentary behaviour in patients, but also in their staff. So this really links to the kind of role of physical activity on mental well-being as well, and then how that relates to then productivity, energy levels, and then the ripple effect of that through all the different layers of the onion that we spoke about earlier for the whole system approach. So one of the ways we're doing that is by kind of identifying advocates within the system. So one of which is Urban Village in Ancoats. Also really pleased to see that Matt from Urban Village is here today as well. So if you're lucky to be in a breakout room with him, feel free to ask questions about this as well. But essentially, we went and visited them to understand what being an active practice looks like at Urban Village, and really kind of use their role as advocates to help influence other practices throughout the system. 1 in 4 people are more likely to move more if it's recommended by a GP or nurse or other healthcare professionals. So it's really key to have these advocates and to make a point in telling their stories. So we went along. They do monthly talk walks where patients are invited to come along and to hear more from GPs, either about a specific health condition or about another kind of health topic or theme. And the idea is that they go on walks around the nearby marina in order to have these conversations, and it makes a huge difference to taking the hierarchy out of the conversation, makes people feel a bit more comfortable with talking about healthcare conditions, asking questions, but also in terms of the movement element, it's getting the steps in as well and getting outside and connecting with people, because as we know, those other elements of moving are so important to physical health and mental health as well. And yeah, speaking to Kay, the practice manager at Urban Village, on the day, she said she knows which of her staff members have been on those walks because they're so much more energized, more productive, have more energy. Otherwise, it's very easy for them to sit at the desks all day without really getting much movement in. So going back to what's really been said about movement mattering to all of us in some kind of way, that is why it's really important for there to be these advocates at all the layers of the system to help really influence change. So again, kind of speaking back to the role that we all play in influencing others in doing that, healthcare professionals have a really key role in that, and we're going to do what we can to help support that and to help make that happen and help that make that a reality. So if anyone knows of any practices, or if there are any practices here today who want to know more about active practices charter or becoming an active practice, or hear more stories, we're really keen to connect with you. So please just get in touch with me at any time. Thanks. Thank you, Neve.
Brilliant. Thanks, guys. And we're going to hand over to Michelle now, hopefully, if Michelle's here and ready to go.
Hi, Beth. No, thanks for that.
Hi.
Hi. Hello. Hello, everyone. So my name is Michelle Childs. I'm by day head of health development at Life Leisure in Stockport. And as part of that, I'm also the chair of the GM Active subgroup. So I'll just briefly give you an outline of what GM Active is in case some of you don't know. Most of you on the call probably will have worked with a GM Active member leisure organisation at some point. So if you've worked with Active Tameside, if you've worked with Older Community Leisure, if you've worked with Salford Community Leisure, all of these are members of GM Active. So GM Active is sort of a member organisation formed around about 2015-16, which brought together all the, well, sort of 11, 12, depends how you break it up, leisure organisations across Greater Manchester to work collaboratively. Next slide. So you might have heard of the word pivot to wellbeing. That's been talked a lot around how actually how can we do more, really? And I think the pivot gives a bit of a wrong idea, because actually we've been doing a lot of these things already. So what we talk about now is more expansion of active wellbeing. There's a number of work streams as part of that, which I'll go into a little bit. But again, this is part funded through Sport England. The 12 Greater Manchester leisure organisations contribute to it as well. We have leisure partners and sponsors that contribute towards this as well. So it's a really, really exciting time for us at GM Active. Next slide. I think it's worth saying some of the things that are already happening. And this is probably what's more happening in the localities. So across GM, there are exide referral programmes, most of you will be familiar with. 15, I think more than that actually, 15,000+ people access these services every year. Falls prevention programmes, again, there'll be, some of these will be things that maybe some people on the call are already referring into or have had participants take part in. Some of our organisations deliver NHS health checks. As part of our organisations, a lot of us are open, evenings, weekends, 362 days a year, something like that. So that gives great opportunities for us to do things like this. You'll also find, and that's happened more and more recently, healthcare providers working within our leisure organisations, and that's really been beneficial because patients aren't having to travel to hospitals to have the care. They can have it in the community, in their neighbourhood, and that also gives them some access to understanding maybe what else is going on in their local area. We've already got strong partnerships with many rehabilitation colleagues across Greater Manchester, sort of cardiac, pulmonary, neuro. There's many more that I've not mentioned, but again, lots of really strong partnerships already happening, and also lots and lots of partnerships already with primary care networks and social prescribing teams. So that's kind of, I guess, some of the things that are already happening, plus so much more. But I have actually got just quite a short presentation. So, but yeah, I could probably take up your whole 2 hours actually talking about what's going on. Next slide. So the one you'll probably be most familiar with GM Active is prehab for cancer. So this was an absolute sort of brilliant project that's been probably started in 2018. Took many years to actually get it to that point. And it's a really brilliant example of collaboration between leisure and health. So the ambition was to have across Greater Manchester an equitable service which enabled patients from colorectal, upper GI, lung, and now lung oncology tumour groups to access prehab before surgery to try and improve their physical activity levels, and which would then in turn improve their outcomes at the end. So that's been going since 2018. If we move on to the next slide. And I guess it's the why need prehab. So these are slides taken from Dr. John Moores, who some of you will know. So he's a consultant anaesthetist at MRI and also the clinical need for prehab. And he describes surgery as marathon. And therefore, if you were going to go run a marathon, you need to make sure that you're well trained. So the importance of prehab really is to improve people's physical, mental, and sort of nutritional status before surgery, so that when they come out of surgery, the impact is less on them. So after you have operation, your function declines. This is more significant, as the slide says, in cancer patients and older and more frail people. And what's been shown and much evidence around that, actually, if you can prepare people for surgery, they improve their outcomes and their health. They have less complications. If you go on to the next slide. And in terms of evaluating the success of prehab, you might not be able to see it. Some of it's quite blurred, but I know you'll probably get the slides afterwards. But one of the things that really stuck out for me was around increase in survivorship for people that completed prehab. If you want an outcome that talks about how good the benefits of physical activity on health, then I think that's a really key one. But there's lots of things that prehab's been shown to do. So, for example, reduce the number of bed stays, so releasing beds within NHS settings. It's really helped improve people's well-being. It's improved. I'm just trying to read the slides, but it's pretty small. They said it's increased the patient flow. There's lots of things that actually prehab cancer has been shown to do, and it's our ambition for longer term is actually how do we mobilise this 20,000 patients. So at the moment, there's only 4 tumour groups, and we've seen roughly about 4,000 people since its conception. So as you can imagine, scaling up to 20,000 is a huge ambition. And that's again thinking about, well, how can we personalise the service based on need? So people might get some things, some people might get something different, but actually meeting patients where they're at and tailoring an approach to that. If you go on to the next one. Just sort of coming towards some of the final slides, we're in a position now where we're thinking as Geomactive, okay, what's next? What do we have to? What is it that we can do to help improve population health across Greater Manchester? So it's that, you know, what's possible? What could we do? Think of that ideal system, and what about if we could make the system more simple for healthcare professionals to refer people into physical activity, where you weren't trying to find, well, do I refer to this? Do I refer to that? What about if somebody lives in Salford but wants to go to Stockport? All those type of things. Could we make that more simple? I think we can. The other thing is that we've been working with Keele University on our active academic partnership. And what we're looking at really is the importance of activation and also behaviour change. And I think that's something that we miss quite a lot. We massively underestimate how long behaviour change takes. Most services are maybe commissioned for 12 weeks, for example, but in those 12 weeks, people don't necessarily change their demographics. So people are still living with, you know, inequalities for that length of time. And also behaviour change takes a long time. So actually, what is it that we need to do to kind of embed that more into our systems, embed that more into services? Measure what matters. So that's really thinking about, well, as it says, I guess, how can we measure what matters? So we're working with State of Life at the moment to actually look at a fairly joint outcomes framework for exercise referral. And actually, there's lots of things that physical activity does that we don't really measure and we don't talk about. So we don't talk about how it reduces loneliness, which has a massive negative impact on people's well-being. We don't talk about self-efficacy. Does it improve self-efficacy? And if it does that have an impact on other people's lives outside of physical activity? Do we really talk about all the social benefits that it brings? So we use in State of Life, which is used something called Wellbe, which kind of corresponds really well to the QALY. And we're doing some work over the next probably 6 months to look at also what works, what doesn't work, where are we actually most effective. And I think this will be a really interesting project for us, and it'll be great to bring back and share that learning later on down the line. But I think the key thing for us is really how, as a Geomactive system, again, can we make it more simple? Would it be brilliant if people got referred to a service and actually, rather than asking what type of physical activity you wanted to do, but we actually asked people, like, where are they? Are they confident? Have they got the knowledge, skills and confidence to change? And if they haven't, then us then maybe starting with a prescriptive program of physical activity maybe isn't the best place for them, but then what is? So at the moment, it's very much much more questions than answers. But these are some of the things that we've been thinking about. And then the last thing is around about designing healthcare that happens in communities, not just hospitals. And I know that's an ambition that's already happening, and it's certainly something that we've seen lots of already from local partners about working within, bringing health into community centres where it's only maybe 5 minutes from where they live, and it's we've seen the real transformative effects from that. So I think that's it for me. From the next slide. Wasn't meant to be war and peace, but it is hopefully gives you a really brief overview of where we're at, where we'd like to go, kind of where our thinking is at the moment. So not just about physical activity, but actually putting behaviour change and activation at the heart of a lot of what we do. And then there's some context there which will be shared afterwards, because we're happy to talk to anybody. Thanks, Beth.
Brill. Thanks, Michelle. That's great. Great to get the perspective from GM Active and then the work that you're doing. And we're going to move swiftly now to Kath, who's going to be doing a couple of interview style questions to Shelley initially, and then another example. So we'll jump straight into Kath, if that's all right.
Yeah, great, Beth. How long do you want us to spend on this one?
10 minutes, if that's all right. Is that
brilliant? Yeah, thanks for that. So yeah, great to hear them from GM Moving and Population Health and Life Leisure. So some really great work there. So I'm head of research at Substance. We're social research organisation based in Ancoats, Manchester, and we've been leading on the GM Moving evaluation since 2019, but more recently looking at health and social care integration. So there's a report we did last autumn, and all in there we sort of cite the history of this way of working in Manchester that's very much not new. So it didn't come about with the Health and Care Act. We're citing it back to devolution and everything that you've been doing, the great work, to joined up work to sort of take charge of health inequalities through physical activity. So that report very much sort of tried to identify what sort of enablers of change that we already have, but what practical approaches are being taken out there, across the priority areas that we were talking about earlier. And so we want to test those. So we're doing another piece of research at the moment to really dig into what are the stories. So we've got these 8 pragmatic sort of recommendations, but in practice, what does this look like when people are out there doing this work? So I want to talk to, first of all, Shelley. So is Shelley here? Hello, hopefully. I think I did see you earlier.
Yes, I'm here. Hi.
Great. Hi, Shelley. So just before we get started, Shelley, could you just tell us a little bit about the work that you've been doing to integrate physical activity into the health agenda, and specifically around women's health in Bury?
Yes, of course. So I know some of the faces on here, but so I'm the Wellness Service Manager at Bury Livewell. I'm an exercise referral officer as well, as a background. But within Livewell, we've got, and I've got exercise referral officers. They're very much exactly what Michelle's just been talking about. That's what we've been doing. But I wanted to have a bit more of a focus on women's health, probably in the last 3 years I've been doing this now. I became a menopause support coach about just over 2.5 years ago, and I realised that as women age, they tend to live longer with worse health because of the menopause and the changes. So really sort of trying to change and adapt the way that we work, but work within healthcare partners as well, and have it on their radar so that they do support women in a slightly different way and have more of a knowledge, because there clearly isn't at the moment at all.
Great, thanks for that, Shelley. And just focusing on one of the sort of practical recommendations, which is about data and insight. And, we can think about data and insight in a number of ways. So data, you can think about, hard data, health stats, facts, those sorts of things, and insight, more communication maybe with the women of Bury to understand what it is they want. How do you use data and insight to sort of shape your delivery and make sure it sort of ticks the boxes and does what people want it to do, but also is based on some genuine sort of insight and knowledge?
Okay. Oh, crikey, we do quite a bit. I mean, one of the big things we do is some of the insights show that as women age, due to hormonal changes, especially losing estrogen and testosterone, that it does have quite a significant impact on bones. And so obviously a big part of the work we do is really educating women on how to keep their bones strong and healthy through exercise, weight-bearing exercise, obviously nutrition and things like that as well. But what we find is that women will then go on to have fractures, falls, that kind of thing. So what we do is when we look at the statistics and we see this within Berry, it helps us to work alongside the Fracture Falls Liaison Service, care homes, things like that, to really start to think differently about how we support women. And a big part of it as well is that women don't go and have as many cervical screens between the ages of 50 and 64 due to hormonal changes. And actually this is really dangerous because women are then going on to have other complications. So we're using those statistics to sort of take it upstream, start to talk to women a lot earlier, and see how they can start to embed these changes and also educate healthcare providers as well.
Right, and in terms of, you know, that data being then sort of helping you shape what would be important and putting, you know, offers on and, you know, actually delivering work across Berry, how do you know that that sort of fits in with what women of Berry would want to take part in? And, you know, what's your sort of communication style or consultation with local people and local women?
When we started doing this menopause work, I'm just going to apply to some sort of comment about the Diane book. Yes, it's absolutely fantastic. So we went out and did lots of consultation within the community. I also used Health Watch to go out and sort of find out what women's knowledge was, what the kind of support they were getting. I even went on a GP webinar and asked 130 GPs in Berry what was going on, and we had quite a good dialogue really. And what we found was that women didn't understand what was going on. There was no communication about this. So I did work with Diane, who just popped up in the chat. And I worked with a lady called Zoe Hodgson, who's my mentor. She's a specialist GP in this field. And they created a booklet. It is so wonderful. It's amazing. And so we've got a booklet, but we also have like a QR code and all our stuff, so that there's information that's really handy, easy to read, that we sort of take out into the public domain, but also that we can provide support sessions. So we did the support sessions all over the borough in different areas. And we find that different townships of Berry need very different things, depending on the education, the skill set, the understanding of different women. Some women are more able to pick up the exercise education. Cardiovascular disease is still the leading cause of death in women due to, again, to estrogen changes within the body and the effect that has on the cardiovascular system. So it's really starting to educate ladies on how to navigate these changes. And HRT isn't the be all and end all, that you still have to put the lifestyle factors in place, but it's making sure that we deliver this information that's right on a population basis. So how I deliver it for the Jewish community in Prestwich, for example, is entirely different to how I deliver it to the Asian community in like the east and west of Berry, and then how I do it on a general population basis. So it's just making sure that women feel they can access this and we debunk myths. And some of the literature I've created, like I'd used a snakes and ladders description how to navigate brain fog the other week, and that went down really, really well. So it's trying to sort of take something really complicated and make it really simplistic so women take ownership of their own health.
Sounds great. And it sounds like you using that insight on local knowledge to really offer a tailored approach to support, rather than some universal offer that you've got that's a women's programme that's going to fit everyone. Really great. Yeah. Thank you. So I just want to touch on a second pragmatic or practical response, and that was around authentic strategic leadership that enables collective leadership. And what we mean by that is people within the system enabling, allowing, giving permission to others to work in a way that's innovative, that allows the biggest change on people to be physically active. And I'm kind of interested in the work that you've been doing across the leisure centres to make the space, you know, accessible, or not even in the centres, but just in the service that you're providing. So how do we know that you're doing this, and how do your staff know that they can work in new and different ways to provide what local women want? And what is it that you're doing to make sure you've got this customer journey right, you know, so that you're actually working in a new way to support people?
I think it's offering things on all levels, because I think exercise as a word can be quite triggering. It really can. So I think it's just talking about movement generally. And I think sometimes when women come to us, they say, right, what do I need to be doing for the menopause? And I'm like, well, this is the gold standard, but where are you now? And they're like, oh, I'm not even walking. So we just take it right back to steps. We call it steps for health. I call it sweaty boob activity, whatever we can do to try and get ladies to move. And so we talk about steps, we talk about flexibility, we talk about weight training, trying to debunk all the myths that if you pick up some weights, you're going to end up looking like Arnold Schwarzenegger. You're just not. And, you know, and it's sort of trying to really get women to understand about if they spent their whole life trying to be small and thinner and skinny, that actually being stronger and muscular as you age is the best way to be. And this mental shift, and as Michelle said, that behaviour change can take a long time. I've got a lady I've been supporting now for 2 years, and we're only just really getting there. She's now in the gym. She now takes creatine, and she's got some guns, and she looks absolutely amazing. But she's had to realise that her whole food behaviour has had to change, that calorie counting is not a thing anymore. We have to understand about insulin spikes. And so what I've had to do with the leisure staff is really help them to offer something right across the piece. But we do operate a community model in Bury. So it's everything from the sublime to the ridiculous. So we have chair-based exercise, we have strength and balance, we have a lot of issues with incontinence in women of all ages. So you've got to go high intensity, low impact, very important. And it was really educating the staff that you can still get a cracking workout in, but you don't need to jump about and what have you. So really helping people to change those information. But what I've done as well is we've really tried to really start normalising the conversation about pelvic floor in the exercises. And I've been at a session this morning where, you know, we talk about it when we sat and when we're getting ready for exercise, we're talking about belly button spine posture, using pelvic floor exercises, what that feels like. And we make silly faces and joke about it. But I think if we can just include it in everyday conversations, and everyone's probably doing it right now, aren't they? We're all working on the pelvic floor right now. I can tell some people are doing this. You don't need to make your face look funny just to do it. You know, you can do it at the traffic lights anywhere you like. But it's sort of just having those conversations and really sort of having it at the forefront of the mind. And then also it's getting guys to be confident and talk about it. I've recently recruited quite a lot of menopause support champions within the council. So it's having those, normalising those conversations, helping to talk about things and understanding that it's okay to say, can I talk about this with you? Is it all right? And having those making every contact count, meaningful conversations.
Great, Shelley. And we can see just from, you know, the way in which you talk about this work that you've got, that, you know, you're an authentic leader there in this space. And I'm guessing that the people around you obviously are, you know, picking up on that language and the way in which you work, and that's having a catalyst effect in terms of the way in which they then offer their conversations and ways of working. So yeah, really good.
Thank you.
Okay, thank you. All right, just conscious of time. That's the two subjects I wanted to cover there, but there's a lot more in our first report, and we're in the middle of writing up our next wave report, which really gets into more stories around these 8 practical steps. And I'll pick up 2 more of them with another practitioner expert in the field next in a while.
Brilliant. Thank you, Kath, and thank you, Shelley. Brilliant to hear about that work in more detail. So just very conscious, we've thrown a lot of information at you there and lots of different approaches and insight. So we're going to just have 10 minutes now to breathe, pause, and go into breakouts and just have a chance to have a chat with hopefully probably 8 to 10 other people in the room about what's resonating and what other examples you might have, or what else you might want to hear about going forward. So Andrew, I'm hoping you're on it and ready to put us into breakouts. Hopefully there'll be someone in the room who'll help facilitate, but if not, please organise yourselves and note down a few key themes that come out, and we'd like you to share those in chat when you come back into the main room. And we're just going to have 10 minutes, so back here at 17 minutes past. So hopefully you'll be going into breakout rooms shortly. I can see people are moving. Yeah, and we'll see you back in a second. Welcome back, everyone. Looks like everyone's coming back in. Did you get cut off conversations, Claire?
Yeah, totally. We'd only just got going, really.
Oh, what a shame. Well, we will be going back into breakout. Sorry, that felt really quick, but really encourage you to drop any key points in chat, any key themes that have come out, that would be great. If you facilitated the room or just as a participant, that would be really useful. I've also got just a couple of minutes if anyone wants to put their hand up or share any thoughts from their breakout. That would be really useful. I'm looking for willing volunteers. Kath, yeah?
Oh yeah, I'm unmuted. Yeah, we had a good chat about data and insight, and a few things popped up in that, you know, it's really about people questioning the objectivity and the truthfulness of data. So activity rates, do we trust them? You know, how much emphasis we put on some data, the importance of then getting quantitative data, but marrying that up with other, you know, qualitative information that you're seeing, getting out in the community and just testing. Does that sound right? You know, and actually going out and doing that. So some great work over in Wigan where they're doing lots of data and insight, and, you know, but we need to be really pragmatic. There are issues around data sharing, and there are really practical barriers there in terms of, you know, getting the right data from the right people and having the right insights. So across the system, is there something we can do around that? And then just understanding that there are lots of other platforms out there, and the Moving Communities platform as Mel mentioned, so the Sport England platform. So yeah, really useful chat.
Real, thank you, Kath. And if people can hear a lot of noise behind me, I'm sorry about that. I'm near a track, and there are about 200 children running around a track at the moment. So it's GM Moving in action where I am. Any other rooms or any other thoughts from anyone I'd like to feedback? We've probably got time for just one more. I see some good stuff being put in chat as well, so thank you for that.
Our room was talking about, we had Matt in from Urban Village Medical Practice, so he was able to expand on the active practices and the walk and talk model that they do there, which was really good. And Matt was just kind of saying after the first session, everyone's always quite shy, but by the second session, things come out during those conversations, and it's really, really can be quite fruitful, really. And yeah, women's health and well-being came up again, and the interest in Michelle's work and what she kind of her presentation on, and also tying up physical activity with creative things as well. So Charlotte was just giving a great example of something that took place in Oldham, but we got put off. So I'll look forward to hearing the end of that story. But yeah, just kind of tying physical activity with creative elements as well.
Real, thanks, Claire. Brill. So we can move on, Neve, to the next slide. I think we're just going to take literally five minutes break. I'm just conscious that we're not putting into practice what we preach. So we're literally going to have 5 minutes. So back at 24 minutes past. But if you want to stretch, have a brew, stand up, or put some more stuff in chat, that would be great. And then we're going to come back to our second example that Kath's going to lead on, and interview another person and bring to life some of the approaches. So back literally in 4 or 5 minutes for the next example. But yeah, please do stretch, move, grab a quick drink, and we'll see you in a couple of minutes. So as people are coming back in, just to reiterate, do put your questions in chat. I can see some really good stuff in chat. We will be collating all the questions and making sure we're trying to answer as we go. But if we don't answer anything, we will be getting in touch after the session. And also I've seen quite a few things around an appetite for more local data, and that's definitely something we can provide, and examples at a local level of the work that's going on. So we will follow up those requests as well. But yeah, please still keep using chat for the last kind of half hour of the session. So welcome back, everyone. Hopefully that was a re-energizer for you, and we're going to move back to Kath now, who's going to be speaking to Alistair with another example of embedding movement into health and care in practice.
Thanks for that, Beth. So yeah, I really want to talk about 2 more of the practical recommendations, but this time very much around the lens of improving mental health and well-being. So we're going to talk to Alistair now, who's Chief Officer newly moved on, but the Creative Living Centre, which is in Prestwich, which are really trying to help and support people in many ways, but notably around health and wellbeing. So, Alistair, hello, and
hello.
It'd be great if you could just talk a little bit about the Creative Living Centre and what you're doing there through movement and activity to have that wider focus on mental health and wellbeing.
Okay. I've actually left the Creative Living Centre. I'm trying to enjoy retirement at the moment, which will involve quite a lot of physical activity because I do enjoy climbing and hill walking. But anyway, the Creative Living Centre helps people on a personal, holistic approach to supporting people experiencing poor emotional well-being and poor mental health. The philosophy of the Creative Living Centre is that we treat everyone with dignity, respect, and we are non-judgmental. And we help them to develop the knowledge and skills and confidence they need to effectively manage their own mental well-being and mental health. And that's done and in a way that's coordinated and tailored to the needs of the individual. It's very much a holistic way of dealing with people's issues. We follow the 5 steps to mental well-being. And for those of you maybe forgotten them, the first one is connecting with other people. Then the important aspect for the purpose of this briefing is we encourage people to become physically active. We learn new skills, we give to others, and we live in the present moment in terms of mindfulness. So tied within our core activities, which is counselling, classes, therapies, we have a very integral part of our delivery. I use the word hour again because I'm no longer there, but I can't get out of it so quickly. We use things like walking, chair-based exercises, Pilates, cycling and walking. Boxercise is very popular. So we integrate those types of physical activities into our day-to-day timetable, and we encourage people, if they want to engage with the physical aspects of our therapies available. And it is actually, I was saying in the breakout group, it's actually quite a light bulb switch on moment when you are in the cafe and people come in from their cycling or they come in from their walking or Pilates or boxercise. You can actually physically see they've been transformed, even if it's only for that 5-minute period or 10-minute period, but you can actually see a very marked change in people's mood when they come back from doing physical activity. And hence the reason it's actually part of our strategic overview of the organisation is that mental health, connecting with the 5 steps to mental well-being, does include that physical activity. So it's part of our core delivery. It's not the be-all and end-all because we've got therapists, we've got other classes, courses, etc. we do, but it is a manifest part of the organisation's culture.
Right, Alistair. I mean, I was going to very much focus on one of our practical recommendations was that physical activity be seen as a core priority across the existing system or service around health and care, rather than an add-on or something that's a nice to have. So that ability for you to be able to say that it's very much embedded within your strategic priorities. Yes. is fantastic in terms of trying to get your strategic goals. How have you also noticed within Bury that has there been a movement to trying to integrate physical activity and align the work that you're doing, say, in the wider strategy for wellness and well-being?
Well, from my perspective, there certainly must be, because a number of grants that we've applied for in the last year in my term of Chief Officer have come from things like Transfer from Manchester, from Bury Local Authority, all of which are based on encouraging organisations like ours to get physically active. We've had grants to allow our walking group to go a little bit further afield. For example, we took about 2 or 3 months ago, we got a grant, it's only a couple £100, but enabled us to hire a minibus and take our members to Hollingworth Lake out near Shaw. And that was a massive massively popular delivery, because there's only so many times you can walk around the locality of the Creative Living Centre and get really excited by it. We actually do enjoy the walking group wherever we do it, but there seems to be an integrated aspect that a lot of funders or funders, local funders, are seeing the value of encouraging people to go out and walking, go out on cycling groups. And we've accessed quite a lot of funding over the last year to actually deliver that as part of our activities. So yes, there is an encouragement locally and in the Greater Manchester area to allow organisations like us to afford to go out and do a bit more in our physical activities. Transport for Manchester, for example, gave us about 5k in the last year to buy a couple of electrical supported tricycles. That came from my own personal experience. I've got my youngest daughter's got significant mental health challenges, neurodiverse challenges, and she's never enjoyed being on a push bike until one day in Oldham we took her to Alexandra Park and got her on a tricycle, and that was another, light bulb moment, seeing her actually enjoy being able to have that independence and freedom of movement on a bike. So we used that as the basis of a grant application to Transport for Manchester, and they kindly offered to pay for a couple of trikes for us, and that has just arrived, or those bikes have just arrived in the centre, and there's a huge amount of enthusiasm amongst those members who, for neurodiverse reasons, have never been able to access push bikes, and they're now looking forward to being able to go out and about and gain movement and exercise on trikes. Just looking at things in a different way. That's really good and great example. It was actually quite transformative for me, because you go to work normally with an element of not unhappiness, but worry and concern, and just seeing the difference of our members when they actually access things like a trike or going for a walk in a different area, they come back in and they're absolutely buzzing. And I know sometimes you should have an academic proof delivery of how you're actually achieving your ends, but sometimes you actually don't. You read the feedback from the members, you look at them when they come back in, and it's obviously working. And I'm a huge advocate of the concentration on the physically active aspect of the 5 steps to wellbeing, and we do get a lot of support locally in small elements of funding. But that's what, as a chief officer of a small charity, that's what you've got to do, is you've got to go out and try and, with the rest of your staff team, try and find those small grants that make the big difference to our members.
Absolutely. I think that's great what you're describing, your ability to sort of leverage funding from other, sort of system funders who are now seeing the work that you do as being really strategic to be able to, mobilise people, get people more physically active, and have that wider agenda really on inclusion and well-being. Yeah. So fantastic to see that. I'm just going to park that one there and move on to the second sort of practical recommendation, which is really us thinking about what we call trusted transmitters or local community champions, people who are out there who really are advocates for the work you're doing and can translate it and, actually get buy-in or engagement across the community. So when we spoke, we talked about various key voices, maybe across the VCFA, but also the the primary care, everyone out there who's doing this work. So how do these translators or people out there, being an advocate, work to help you deliver at a local level?
Well, I think from my perspective, it's the understanding of what we deliver. We've got there again, we again. The centre of a very strong link with the local social prescribers, so they know that they can feed people into us who may require assistance in what we do. We've got very strong social media outputs, so we can publicise to the bigger world through Facebook, Instagram, Twitter, or what is now X, and we have our strong links with all the players within the local. I mean, you mentioned BVCFA. We've also got strong links into Bury Local Authority through Jim McGlynn and his mental health office. We try to work as part of a bigger team to deliver what we need, and I think the fact that we've got supporters out there, at our annual general meeting 2 or 3 months ago, we managed to get some of our local councillors come in, and one of them has actually become really proactive in helping us, and she at her level promotes what we do. So it's all about getting the message out there, but knowing that we have got the support and backing of lots of other parts of the establishment out in Bury and Prestwich is very important to us. The other aspect which I wanted to just focus on is that we're very much member-led. We actually don't just carry on thinking we're doing everything right. We have a monthly meeting with our membership, and they tell us where they want to change things, if we want to do things differently. And that all helps in terms of us understanding what is actually working. We have a very fundamental feedback process that everything we do, we actually get feedback forms and get people to actually write in what they think about what we're doing. But if something isn't working, we don't keep on bashing it until it works. We just say, right, that's not worked. Why is it not worked? Ask the members, how would you like it to be delivered next time? And we change it. So if you looked at our monthly activity schedule for this time last year and compared it to this month's activity schedule, they would look similar, but there'd be a huge amount of differences. But that's based on feedback and changing activities on the needs of our members and what's working and what's not working. But yes, to go back to your question, yeah, we do have very strong links with all the local players who we think we'd need to. And we're always open. We have open days when we invite the local community to come in and see what we deliver. They may not have actually wanted to become a member, but they might wonder what's happening in this organisation. And our open days actually, funnily enough, actually gets us more members. People actually come in and see what we're getting up to and say, you know what, I could get help from that. So
brilliant, thanks for that. And I can just see loads of evidence of you brokering relationships and you listening to the voices of various communities and people out there to design what it is that you're doing in a really tailored way. So fantastic examples there. Just conscious of time, Beth, are we going to move on to the next stage? Just want to say thanks so much to Alistair. I didn't want to say you'd retired in my intro because I'm not seeing much evidence of that. So yeah, thank you.
Brilliant. Thank you, Kath, and thank you, Alistair. Brilliant to get your perspective, and yeah, thank you for your time. Even though you're officially retired, it's great to have you here and have your voice in the room. Brill. Another great to just get close to that work. It's an area of work that I wasn't aware of, so brilliant to hear about that, Alistair. Thank you. People are coming back in. Welcome back, everyone. Give it a few more seconds. Yeah, welcome back, everyone. Hopefully you got a chance to have a good chat there. Again, if you've got anything you'd like to feedback, please do drop in chat. If any of the facilitators like just to share any key thoughts, that would be great. Anything that particularly resonated or any ideas going forward. We've got a few hands up. Who we got? Lauren, go to you.
Oh, going to me first. Okay, perfect. I think I just wanted to reflect on an honest conversation in our room, whereas sometimes this is quite big. It feels a lot. It can feel overwhelming, and actually that was quite raw for a couple of people to mention within the group. And we had a really good conversation around like small steps, the stories we've heard, the role that physical activity can play. And we talked particularly around the existing framework of the active practices, and that we can sort of support and facilitate some of that. At times you can not know where to start and know whose role it is. We also then went on to sort of talk about how different it can be and tailoring it for education, health, community, and the way that the workforce needs that to be tailored for them. Selfishly, I was advocating for physical literacy, and I work within the Children and Young People team. But we talked about, you can be at any age where you sort of build up a knowledge and confidence around physical literacy and habits of physical activity in your life. So yeah, I was talking about that with colleagues. And then I think the last bit was just around advocating and having a champion that, you know, within any area of work, because you will be able to find that person, and sometimes holding on to them and sharing their story, as we've heard from colleagues today, is sometimes a really good starting point.
Real. Thanks, Lauren. Kath?
Yeah, we had a great chat in our room, and people would just like to take their great models of work. So Shelley, for example, talking about what they've been doing, you know, embedding physical activity, but into other maybe priority areas, policy areas, if you like. So speaking to children and young people, and getting people work ready or economically inactive population. So they know what to do. People are ready to do this work. It's just about having the time and resource and, you know, making that next step. In terms of what maybe could be offered or what GM Moving can play a role in, it's about that data and insight and understanding, you know, what's the go-to, what is it that we're saying this is the data that is robust and reliable. If you're going to try and demonstrate this, do we have a sense of you know, what would be reliable information if we were going to try and argue a case for something? So just doing more of this, and some great work in Wigan happening, really looking at the prevention agenda and really thinking about unlocking funding through demonstrating what they can do in that area. So, you know, that's a real focus there, thinking about well-being as well and testing that, but also looking to other policy areas. Are we looking to DWP? What is it that we need to say we're doing to be able to contribute towards these agendas, to be able to get that flow of resource and money, to be able to do our deepening work and really get this, you know, this great model that we've got working and applying it elsewhere.
Real. Thanks, Kath. That's great. Claire, is that a hand up or down? Have you gone?
Didn't know whether we were struggling with time, so
Yeah.
I put it down.
Go on, go for it. We've got enough time.
Well, we spoke about next steps, and the Shelley's kind of story and the work that she's doing really resonated with the people in our room. There was Shelley, but we also spoke about some of the brilliant examples that have been shared today. It's about kind of providing the tools to people, so showing them how they might be able to do that, replicate things in their place as well. So that would be really useful moving forward. Also, we spoke about language and sometimes jargon, medical jargon that's kind of put out there, and trying to keep things more simplified for certain kind of people, but also, you know, then on the flip side of that, some people do like kind of medicalized kind of language as well. But we were talking about funding issues and having to put buzzwords in application forms for funding to help support. But yeah, really great. And we have lots of connections that are going to happen following this meeting, which is brilliant.
Real. Thanks, Claire. That's great. And we'll collate all that information together and share it after today as well. I'm just going to quickly go to Menti and encourage you to go back to Menti, really, and just if you remember what the code is or the QR code, hopefully you've still got that on your phone or your laptop, and just take a minute just to answer the question on Menti, which is, what is your main action priority coming out of today? Some of that's been already mentioned in chat and also from the feedback from the facilitators, but yeah, please put in your main response or thought about what you're going to do next after today. That would be great, and we'll just give a couple of minutes to let you do that, or a minute even. Real, some good stuff coming through. And just while people are doing that, just to reiterate, we will be sending out all the slides and information with links to the different case stories and examples that we've heard today. So you'll get all that hopefully tomorrow at the latest. And we will be inviting you to get in touch as well to follow up. Brill. And we'll be sharing all the information that's come through Menti as well. And then just one final question. Just to get a gauge of awareness following from today. Has that decreased, increased, stayed the same? We might have different people answering, but it'd be great to just input into that if you can, and we'll leave that open as well while we finish off. Looking like that topper end, which is looking good. But yeah, keep answering that while we just come back to the main room. That's great. So just wanting to close really and thank everyone who's contributed today, particularly the kind of speakers who've put together their case stories and examples. So, you know, a big thank you to Dave and the population health team for your contribution. Also Claire and Imogen, and Kath, Shelley and Alistair, and then the team behind the scenes, Andrew and Neve, doing a sterling job. Technology, it was almost 100% okay, but maybe not quite there, but we nearly were there. So yeah, so please do put any further comments in chat. Get in touch on social or via email. I think we'll be sending out contact details, like I say, after today's session. And yeah, a massive thank you for taking part and your engagement. There's been some great conversations in chat and in the breakout rooms, and a massive thank you to everyone's engagement today, because this will really help us continue our momentum going forward, but also give us some insight and thoughts about where next and what else we need to do, and that's certainly come through your comments in chat. So massive thank you, and I hope you enjoy the rest of your day. Thanks everyone.